So we are here with Cone Health's Chief Pharmacy Officer, Dr. DeAnne Brooks, and she's answering your COVID vaccine questions. We've got the number at the bottom of your screen so that you can text us your question. All right, so this person is asking, I had the COVID booster several weeks ago, and lately I've been a little dizzy and having balance issues. Any chance that this is related?
That's a great question, and I would say this far out from receiving the vaccine, it might be unlikely that it's due to the vaccine, but just to be on the safe side, I would recommend that anyone who's having any kind of symptoms like that of balancing and dizzy issues to contact their doctor and speak with their doctor about it.
This person says, can you get your booster if you currently have a cold?
We do recommend that you're feeling well on the day that you get any vaccine. So I would wait until you no longer have symptoms and then go get your vaccine or booster.
Why are they not giving the J&J for kids as well?
So we're not giving Johnson & Johnson for the 5 to 11-year-olds, nor Moderna for the 5 to 11-year-olds because it has not been authorized to give yet. We do expect that maybe by the end of the year, Moderna may have approval for the younger age groups, but we don't have that just yet.
Okay. This person is asking, when and where are they giving the booster shots, and do you need to make an appointment?
Yes, you do need to make an appointment, and we are at Cone Health giving the vaccines at the Coliseum again this Saturday and Sunday. You can make an appointment for a booster vaccine or an original, your first or second dose of vaccine. We will have all 3 vaccines available, and we have also reserved appointments for our 5 to 11-year-olds specifically as well. And we have many appointments available on both Saturday and Sunday, so please go ahead and sign up now.
Yeah, good to know. Okay. This person says, I'm a senior citizen and scheduled for the Moderna booster on November 16th. When will I have full immunity after that booster?
Yeah, so we typically say about 14 days after receiving the vaccine, the second series or the booster, that you're going to have the full boosted immunity again.
All right, so this person is asking, is it true that the Moderna booster has been shown to have higher efficacy for those who originally got the Pfizer vaccine?
Yeah, so I've looked at some of the data on that, and it's both of them are going to give you enough antibody response to be able to give you good, strong immunity. There were some studies that showed there might be a possibility for an increase, but it really hasn't been fully defined. And so it would really be fine to get a booster of either one.
All right, and this person says, I can't find my vaccine card with proof of my vaccination on it. Can I get my booster without my card, or do I need to get a replacement card? And if so, how do I do that?
So you can get your vaccine without having your card. We do need to know when you got your second dose so we can be sure that it's time for you to get it. And you can get a replacement card. And if you go onto the Cone Health conehealth.com/vaccine website, you will see a link that you can go to get a replacement card.
And my question about if like a grandparent watches your child and you want your child to get a vaccination, can the grandparent take your child to get that shot?
No, it has to be the parent or the person who is authorized to care for the child to sign the consent to get the vaccine. So it can't be an aunt or an uncle or a babysitter. It has to be the parent.
Okay, and this person says, if you were diagnosed with COVID on August the 16th, when can you get the booster?
If they were diagnosed with COVID and they're asking about the booster, we're going to assume it's been 6 months after. So once they are not symptomatic and are out of quarantine, so typically within 10 to 14 days after testing positive for COVID-19, they can get their booster.
Now, you don't get a booster, though, before you get vaccinated. You should get the full vaccination first, correct?
Right. Yeah,
okay.
That's what I was saying. Assuming that they had dose number 1, dose number 2, and now they're getting
number
the booster.
3, just in case. You never know. Okay.
Thanks for that clarification. That's really important. So just because you've had COVID-19, the illness, and tested positive for it, you still have to get the full vaccine series. So you would get dose number 1 and dose number 2 of Pfizer and Moderna, dose number 1 of Johnson & Johnson, and then you can get a booster at the right time.
Okay, we're going to take a quick break. We'll be right back with more of your text questions.